Do you know what goes on in a rhinoplasty? I'm a plastic surgeon in Boston, Massachusetts, Dr. Jeffrey Spiegel. Let me tell you how we decide what to do when you're looking at someone's nose. This woman's nose has a bump. First one to see. Now that's the obvious thing, but there's more than that. The tip is kind of pointy, and the nostrils are a little bit slit-like and too narrow. Those are small, subtle things that not everybody is going to pick up. What we do here is we lowered the cartilage and lowered the bone on the top of the nose to get rid of that bump. I also rotated the nose just a little. I deprojected the nose. That means bringing it closer to the face, and all that allowed the tip of the nose to get a less sharp and angular appearance and a little bit of a softer round appearance. Additionally, I was able to curve the nostril shape just a little bit. Now here is a much harder situation. You need a lot of experience to tackle this nose. What makes this different? Once again, we have a bump, but this nose is what's called a tension nose. In a tension nose, the cartilage of the septum grows too big, it gets too strong, and it projects outward, and it pushes up the top of the nose, and it gives you sort of a double bump on top of your nose. To reduce all that requires a lot of work. You have to really deconstruct the entire nose and then put it back together. And then you allow the skin to contract down, and getting a nose that's that large to a smaller shape like this, that takes a lot of work, and it requires some real use of all the techniques of rhinoplasty.